Welcome to PodTox episode 17, I believe. 17 or 18, we're somewhere around there. Today we have Dr. Dave, and he is going to be talking to us about safe supply. And of course, we have Marie, the lovely co-host. I think real quick, we want to go ahead and start off just talking about the basics, what got you into medicine and everything, and then we'll get into the safe supply stuff. So where did everything start where you were even interested in being a doctor?
Both my parents are physicians. They survived the Holocaust and became doctors. And my mom's a pediatrician at Columbia for 50 years. My dad was the head of the VA in New York City Veterans Hospital. And I went to Columbia Medical School and became a doctor. And I started out in surgery and trauma, and then I switched over to ER, and then I do general medicine for like 30 years on the Lower East Side of Manhattan. So I'm an MD on the Lower East Side of Manhattan. So I'm a community neighborhood doctor. I do lots of social programs, which I'm really interested in. I do one for the New York City Fire Department. They made me a fire chief a couple weeks ago. So I have a badge and everything. And I show my badge. And then I do one for removing tattoos from survivors of trafficking. We try and do that for free. This is my badge they gave me.
Wow, good job.
Yeah. I've always wanted a badge. I never had a badge. And then I also do one for restaurant workers, because a lot of restaurant workers in New York, restaurants are the #1 employer in New York City and actually in all cities. And the workers have no health insurance. They can't go to a doctor. They can't go to an ER. And what happens is their healthcare plan is this. Let's see what happens. So they work when they're sick, infecting others, and they can't take a day off because they don't get paid. And they can't spend $1,500 in an ER to find out they have a cold or what this thing on their skin is. They don't know what they have. So they can't decide if what's wrong with them is something serious or not serious. So I started this project called the Restaurant Workers Program. So I see them all for free, and the restaurants put in money in a pot, like a coffee can, a few $100s a month is all it takes. So it's kind of a microcosm of what national healthcare would work like. So for one restaurant has 50, 60 employees, for $300-$400, they can give them all free healthcare.
Wow.
As opposed to $2,000 each, which is $100,000 a month. So it's $100,000 a month versus $400 a month. That's the difference between national healthcare and for-profit insurance. But that's another story for another show.
That is super amazing because, I worked in the restaurant industry for 6 years. So I know how that is, and I never went to the doctor. And of course, during that time, I was in active addiction too. So I really didn't go to the doctor, and there were so many things that went wrong randomly, and I could use something like that, definitely.
So you can avoid disasters that way. I'm also the medical director of the lab, the clinical lab at a harm reduction in the Bronx called St. Anne's Corner, a very famous place, been there 40 plus years. When you get shot in the chest, the arm, the leg, whatever, it's very expensive. And for what?
Right.
It's all about, none of those are shooting each other. It's all about territory and drug dealing. They pay for their bullets and their guns with drug money. So I think it's, if you give people, here's the thing safe supply. Two things I'll say, because we have such a short time. Two things I'll tell you is that the street drugs, the stuff you buy in the street, I call it MSP, mystery street power. And last year, 108,000 people died in America from what they call overdoses. And I use the quotes because none of those were overdoses, maybe two. Take 100 pills and drink a bottle of vodka with a note. That's an overdose.
Right.
Or they take an incorrect dose. That's not what's happened. They're getting poisoned because they're injecting fentanyl, that vitrine, whatever it's called. And when they study this, and there's studies about this, those bags you buy in the street have feces, sperm, urine, Ajax, melamine, baby powder, any kind of thing, and it's not sterile. There's bacteria in there, so you don't want to inject that in your arm. So those people who died were actually poisoned from an adulterated supply. It wasn't a safe supply, it was a street supply. I don't blame the street dealers because they're not in charge of this at all, but they're like the 8th or 10th person to get their hands on the stuff. It starts as a kilo of heroin, it gets cut into 8 kilos, mixed with whatever. There's all kinds of stuff in there that shouldn't be. And although sperm is unpleasant, it's not going to kill you, but the fentanyl will. And those people didn't die of overdose. So my position on this is to give it, to legalize prescription heroin or prescription long-acting morphine, same thing. You also can use buprenorphine. I can't pronounce it well. It's a chemical which is it's a partial agonist, which means it's not as strong as morphine, but it gets rid of the cravings, and it's used successfully to treat addiction. But here is, because we have short time, I'm going to get you right to the very core of the problem. Right now, an addict can be in two places, basically. On the street, buying street drugs, which involves a lot of peripheral problems, which is prostitution, sex trafficking, violence, poisoning, crime, prison, police, ERs, ambulance rides, courts. It's $30 billion a week is what you're spending on this nonsense. It's crazy. For what? 50 cents of morphine. So the other choice of your place you could be is in recovery. Going to group, taking medicines, taking antidepressants, trying to be sober, working the blah, 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 all the stuff you do, the 100 things you do to try and be sober. Very difficult, but good for you. What I propose is a third space. This is the core of the conversation, which is between recovery and street. And that space is called We Don't Care. And that's hard to sell. So I propose to give prescription morphine to addicts. You don't call them addicts anymore. SUD, substance use disorder persons. And just give them morphine. And what's critical about this space, I've learned, is you can't ask them to do anything. You can get your morphine 2-3 times a day. No religion, no psychotherapy, no programs, nothing. Have a nice day. Here's your drug and your medication. Watch TV, have some cookies. We don't care. And I know it sounds paradoxical, but you want not to care because they can stay there for 2 weeks, 2 years, or 20 years. It doesn't matter.
Right.
It just gets asses in seats. It brings them into the care. You're going to get them in. They're going to be a line around the block. They're all going to come in for free morphine, right? If you had, say, 100 such people getting free morphine in a pilot study, I predict a third will stay there till they die when they're 80, 90 years old. God bless them. I don't care. They don't hurt anyone. They live their life as they can. They adjust their dose to 5 to 20 milligrams. Leave them alone. Who cares? Another third will go to get sober. They're going to go, you know what? I want my life back. I don't want to be high every day. I want to get back to my job and my family, my kids, whatever. And I want to go in recovery. God bless you. Here's recovery. There's the blue door over there. Go to recovery. We'll help you everywhere we can to recover. The middle third will go in and out. Sober 3 months, getting high again. They're going back and forth. But the point, those three groups won't cost us anything. So I think if you sell the economics of this, you can't sell compassion. You can't sell science. You can't sell rational thinking. You can't sell society, lefty, liberal things. You can't sell that to the people in charge, the other half of us. Sure. But you can sell money. And right now they're spending $30 billion a week. We can drop that down to $1 billion. Just by giving out, and I'm talking about prescription morphine in a controlled environment, in like I say, a harm reduction place. I'm not saying bodegas and like recreational. They always talk about recreational drug use. People who have substance use disorder are not taking drugs for recreation.
Right.
They're taking them because they have to. So don't call it recreational. That bothers me too. That's like a lot of peas under my mattress. So mystery street powder, these are not overdoses. These are poisonings, or you can get away with accidental poisoning if you don't want to make it criminal. And it's not recreational. They have to take it like insulin.
Would it be oral or is that intravenously? Like, how would you do that?
I think you would start with IV people because at the place, there are places where you can come in and shoot up your drugs, but I find that crazy because we're giving a sterile needle, but they bring their dime bag in and they're injecting who knows what.
Right. And
you can check it for fentanyl. Some people have these test strips, but I think it's nonsense because when it's fentanyl, I saw this, when their drugs are positive for fentanyl, they still take them. They don't throw it away. They're going to take it. It's $10.
Yep.
Now, there's a couple wonderful side effects about this. The biggest one is money. It doesn't cost anything to give them prescription morphine. And who cares what they do? It's like a doctor-patient relationship. None of your business if someone has insulin or someone is schizophrenic or someone's depressed. It's not your fucking business. We treat them, and it's just a drug we give them, a medication we give them to keep them comfortable and stable until we can get them better care. And I'm allowed to prescribe morphine to anyone in the United States. We give morphine tons a day. To every surgery gets morphine. Every heart attack gets morphine. Every hospice care gets morphine. Every cancer patient gets morphine. The list with trauma victims, they all get morphine. So we are allowed to prescribe morphine to anyone in America except people with substance use disorder. And that's the crazy thing.
Right.
We're allowed to prescribe morphine. I have a license to do it. I'm a DEA member. I can prescribe whatever the fuck I want. But I'm not allowed to give it to an addict. And if you go back 60, 70, 80 years, prohibition's a failure. It just creates a gigantic interglobal trillion-dollar crime syndicate, which funds every war in the world, which is another show. But the narco dollars is a lot of money. And that's how they buy weapons and fund wars and horrible things everywhere. They even buy explosives to kill our troops in foreign countries. So that's another pitch for the MAGA people. So the idea is to have a safe supply. You can never do this politically or in America. However, you could do a pilot. You could probably pitch a pilot where it's under the auspices of a study. Therefore, the DEA, but the FDA could approve a human trial, they would call it, where you get 100 addicts, you follow them for 2 years, give them the morphine 3 times a day, and what you want to measure is if they get arrested, if they do crime, if they interact with the police, if they overdose, which they won't, or get poisoned, because they're not going to get poisoned. And the last thing I'll say, which I thought was funny and surprising, they did this in Vancouver for a short while in a small scale. And the funny thing happened. These people, for the first time in 10, 15 years, had a day off. And no one thought of that. They had the day off.
Right.
They didn't have to hustle and get $10 3 times a day.
Yes, so peace of mind.
They couldn't go to the court. They couldn't fill out. They couldn't get a driver's license. They couldn't go to therapy. They couldn't do anything. Look for a job. They couldn't sit down and take a breath. They had to hustle, 24/7 every day of the week. Not off for Christmas. Not off for New Year's. Every day, weekends, Sundays, every day. So these people were befuddled. They had the day off. They had 10 days off. They have 30 days off. And now, because of that, they could slow down, take a breath, go to therapy, go to group, get tested for hepatitis C, drink a shake, whatever. They could chill out, get some warmer clothes, get new shoes, take advantage of the 300 programs that are available. But if they're hustling $10 3 times a day, they don't have time for that. They're very busy.
How is this battle going to go with actually getting the medication? Because the chronic pain patients and, anyone having just regular surgery or anything, they aren't able to get the pain medications now. So is there going to be some sort of give on the DEA side where they're going to stop cutting back on pain pain pills?
No, the DEA is not a doctor.
Right.
Don't think of the DEA as physicians. They're law enforcement.
Right.
Forget that. Never going to happen. However, we just got in New York State and probably other states, we have a 7-day grace. We're allowed to give morphine for 7 days for acute pain. I don't do pain control. But pain control is a separate, think of if you need your aortic valve, you need a heart valve replaced, right? Say someone gets heart surgery and they go to the hospital and we're going to open their chest, put them on bypass, like a machine for, fake heart, open their heart, take out their valve and sew in a new one. That isn't 2 guys. That's 30 people.
Yep.
It's a complicated, big deal. You have to have preoperative care. You have to have lots of studies. It's a team of a lot of people. And then during the surgery, it's 6 or 8, 10 people, all highly trained. Then they go to the postoperative care, like an intensive care unit for another 7, 8 days. Then they have other doctors for months and they, for infection, rejection, blah, 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 blah. Anticoagulation, lots of things have to happen. That's pain control. Pain control is like that. You can't do it. Go to a doctor, give me some pills. That's a terrible thing to do.
Right.
You'd have to make places that have a team. And the team would include rabbis, imams, priests, doctors, nurses, the specialists, the CAS specialists, addiction, SUD specialists, and all kinds of people. And you can't do this, but the fantasy would be a strip mall. You have a strip mall, in a building somewhere, inside a hospital. And that strip mall would have all the services they need right there. Because you can't go to 12 places in a city if you have SUD with no money and no bus pass and no wherewithal. You're not going to go for your 3 o'clock meeting uptown, your 9 a.m., 8 o'clock in the morning at the Social Security, go see the judge at 3:15. It's a nightmare. You can't do it. So of course they miss all their appointments. It's a mess. So you make a strip mall. It's all right there. There's a court, a little mini court. There's a psychiatrist. There's AA. There's all the other A's, all the anonymous things, therapists, pharmacists. All of it, 12 little stores, basically. You with me? Yeah. The malls are empty now. We can use the malls. The point is,
wraparound.
It has to all be there. You can't have people doing pain control by a doctor in their office with 30 other patients you have 3 minutes.
Right.
Doctors are busy. I'm not, because I'm nuts, but doctors are busy because they live like that. And they're seeing 10, 7, 8 minutes per patient. You can't do pain control in that time. Because it's very uniquely individual. Yes. People are different ages, so that makes a difference. The kind of pain they have is different. Their tolerance to pain control is different. Their economy is different. Their education is different. Their life circumstance is different. Their housing is different. Everything's different. You know, are they in a wheelchair? Do they need, you know, it's endless. I mean, it's really endless. You got to have a team to take care of this. The mistake is a setup to fail. Doctors just giving pills. Here's your pain pills. Have a nice day. Disaster. Of course they're going to get, you know, take the wrong dose, take too much. A third of people have substance, what are they called? Addiction disorder, like emotional addiction, whatever. It's a diagnosis.
Oh, yeah.
So they're easily become addictive. 2/3 of people don't have that. They get morphine in the hospital for 5 weeks and they don't take it. I go, Doc, don't give me any more morphine. It makes me nauseated. It makes me dizzy. I don't want it. It's horrible shit. I don't want it anymore. Those people aren't going to become substance use disorders.
Right.
Another person who has terrible emotional anxiety and mental issues, they're very stressed out, post-traumatic stress, poverty, money problems, emotional problems, family problems. You give them morphine, it's God fucking bless. This is great. I love morphine because all my problems go away. And so these are different animals. So
Right.
You cannot have. Here's a great thing you guys should do for your show. This is a great one. In medical school, when you teach students, you ask them as a trick question, what's the treatment for abdominal pain? And they all raise their hands. They go, oh, appendicitis, antibiotic surgery. Those are all wrong. The answer is you have to find out why they have abdominal pain. And it won't be the same in 100 people. There's an ectopic pregnancy in one, appendicitis in another, gallbladder, gallstones, renal infection, kidney infection. I can tell you 80 things. Ulcers, hepatitis, pneumonia even. It's endless, the things that, so you can't, there is no such thing as a cure for abdominal pain.
Right.
And there is no single cure for people with substance use disorder.
Right.
You always say this, oh, this is the new treatment for substance use disorder. This is what we're going to give to addicts, and this is going to make them all better. Methadone, whatever, I'm not going to name them, different drugs and whatever.
Yeah.
But that makes no sense. You have to have, like you said, a circle of caretakers to figure out this person's needs and treat them, manage them, and treat them over years.
Continuity of care, right?
Continuity, but also variety. You don't know what they're going to need. You can't have 100 addicts. You can't have a 22-year-old schizophrenic and an obese diabetic and a 80-year-old jazz musician and treat them the same. They're not the same people. Or a wealthy person and a poor person, a gang member who's 14, or a post-traumatic woman who's had sexual violence and got out of trafficking. And they're not the same people.
Right.
You cannot treat them with a single program, a single, pathway, care plan.
I agree.
So you have to change the paradigm. You have to, if you want to, and nobody wants to do this, but if people want to, remember the thing, Kennedy, we're going to go to the moon? I don't know if you two guys are too young, but we're going to go to the moon. That was we all got together, we're going to go to the moon, put a man on the moon, right? So how many people did that? 40,000? It wasn't like 3 guys. It was thousands and thousands and thousands, probably 400, 500 different factories to build bits and pieces of a rocket ship. I don't know. But you can't treat the addiction problem and the substance use disorder problem in this mindless, simple way, like it's like you cut your finger or something. It's just not the same. You need to have a program that deals with this issue. And we don't have that in the United States. Actually, we don't have national health care, another show. But because we don't have national health care, what we have is 5,000 very greedy companies in the health space trying to make as much money as possible. And that doesn't help anyone. So if you're really poor, you get Medicaid, which has zero, very difficult resources, and you got to be like a genius to figure it out. I couldn't figure it out. You have to go to different places at different times, wait for 3 hours. There's no food there. You're at the wrong line. You got the wrong card. You can't do that. It's a nightmare. Or you make over 10 grand or 15 grand, whatever it is, and you can't get Medicaid. And then you're screwed because now you can't afford $2,000 a month for insurance.
Right.
Even if you could afford insurance, they don't cover everything. They only cover certain things. And you ever heard the word copay?
Yeah.
Yes.
Like you have a copay?
Yeah.
You know what that really is? It's a you pay. It's not a copay.
Sure.
They do tricks like this. Oh, it's a copay. I pay you $500 a month. Piss off. Why am I paying you $50 to get my penicillin? What's this copay bullshit? I'm paying you money. Where's the copay? What are you giving me? So they do all things like linguistic things. People think, and they're nuts. People the advertising is so good and so powerful that people think they need health insurance.
Right.
What you need is health care. You don't need health insurance. Health insurance doesn't insure your health. It's a tricky language. If you get hit by a bus and break your femur and they drag you into an insurance building to the 18th floor in the CEO's office, they don't know what to do. They can't provide health care.
Right.
They're an insurance company. There's a bunch of people in suits and cubicles. They provide zero care, but they collect all the money. They used to be called, in the 1930s, that was called the protection racket. Now they call it health insurance.
So with this too, so you're saying you wouldn't push them towards all of this other stuff either, though. It is literally just there and available whenever they come and get their medications to go to as they please.
Because of the Sackler travesty, everyone's got all uptight about giving morphine to anybody. So they're trying to cover their asses kind of to make it now, okay, we won't give morphine to anybody and we'll be okay then. The goal is not, I say this tongue in cheek, the goal is not to help anybody, is to neutralize them. That language will sell to the right. You know what I mean? Like the bad guys. We're not trying to help these people. Yes, we are, but don't say that. We're not trying to help them, we're trying to neutralize them. When you give them morphine, they'll say, shut the fuck up. They don't get shot, stabbed, arrested, steal, suck up the ER time. Have you been to an ER? It's like Dante's inner circle of hell. People handcuffed to stretchers, there's 60 people vomiting, peeing on the floor, shitting on the floor, ripping their lines out, and there's 3 nurses. It's a complete, unimaginable disaster.
And the wait times are over 24 hours. Some of the wait times at the ER are 24 hours.
Because they're clogged up with people who either can't get their drugs, so they're having withdrawal, or they did get their drugs and they've been poisoned. And then you won't have people nodding out in the streets or begging for money on the streets trying to get their $10.
How much can you get per day too? Because what is going to be the draw that actually brings people in? Because yes, it's there and available, but if it's not enough to get them to where they need to be, what's everybody going to do to kind of adjust for that?
Remember, this is we don't care zone. We give them any amount they want. They have high tolerance. If you gave 60 milligrams to a regular person, they would stop breathing. If you give 60 milligrams to a real user, that's like Pez. You figure it out. Like I said, it's individual.
You're right. That's so true.
You have to give them the amount 3 times a day. But if I give you 10 milligrams of morphine from a bottle marked morphine from a pharmaceutical company, that's what it is. Right. There's no bacteria in there. There's no fentanyl in there. They won't get poisoned, and they can live forever, and they won't get heart valve infections. Their hands and feet won't fall off because their vessel's closed. No one dies of heroin. They die of the impurities in the heroin.
Right.
You ever see like their arms and feet are all cut up and puffy and swollen and they can't walk anymore? That's not from heroin. That's from the crap in the heroin.
What about like nitazine?
Nitazine is another story. Nitazine is a different show. That's like 10,000 times stronger than morphine. That's going to be a complete disaster. That's stronger than fentanyl.
Right. What do you see with the future with that? Because I know here in Massachusetts, it's already in 60% of the supply.
It's going to be a huge amount of dead people. That's the future. A lot of people are going to die. It's barely reversible too. I don't think Narcan even works for that. If the nation wanted to solve this problem, they didn't look at addicts as like subhuman and evil, and they deserve it because they're bad people and it's a choice they made, and whatever. That's why no one wants to help them. Mostly because the TV shows and movies doesn't make addicts look real good, or prostitutes even. I mean, the
stigma.
It's a stigma. The stigma is like off the hook. So if you wanted to fix, if there was a motivation and the energy to fix this problem, the way to fix it is save supply. Not complicated. It would work, and would make the problem go away.
Do you have a lot of doctors having are you having a hard time getting some other doctors to be on board with this?
I don't work at a hospital. Most doctors do. Those doctors can't say stuff in public. Because if I'm a Mount Sinai doctor or a Columbia doctor, like at the medical center, I can't talk like this because I represent the hospital.
Correct. Okay.
And I can't be a cardiologist and say, oh, we should give everyone morphine, because they're going to get a phone call from the director. So you can't say that. You can't be in the news saying that. And you can't say anything about anything. If you have a patient who's famous or whatever, and you fix their leg or sports or their arm or whatever, you can't go on TV and say, oh, John Smith was here and he had a stroke and you can't do that. It's all secret. And the hospital will have a media spokesperson, a paid public relations person, which will say whatever for them. So you can't go around saying we should legalize heroin, because that is it's the right thing to do, but it flips the whole paradigm. It changes the entire 70 years of drug enforcement.
Is morphine the only option too, or is there other things? Because obviously not everyone is just addicted to opioids, and fent is being found in multiple other things. So what are the other options if it's not just the
Well, it's
opioid?
not. It doesn't. I would start with opiates because that's a big cause of death. You
Sure,
don't get a lot of marijuana death from fentanyl. You get some probably, but not much. Alcohol kills more people than, morphine anyway, with
sure.
car accidents and suicides and gunshots. So alcohol is way worse than morphine, but that's a big industry. They're not going to stop selling alcohol or make it, controlled or whatever. I don't know.
What about
But I would stick with
benzodiazepines?
morphine. That's Valium. It doesn't cause a lot of death. You have a receptor in your brain called an opiate receptor. It's a morphine receptor. It's like a lock and key. So any kind of opiate you take, and there's 30 of them, Oxycontin, oxycodone, Dilaudid, Demerol, all of them, go to your liver. And without exception, they become morphine sulfate. That's the molecule that goes to your brain, attaches to the receptors in your limbic system, and makes you high. So they all become morphine. So you can inject morphine directly, or you can inject these other things which have different timelines, like, works over 6 hours, works over 8 hours, but they all become morphine. So morphine's the common denominator for all those medicines. I'm just saying to give them morphine because it's less expensive. It's cheaper.
Okay.
And then over months, you can then you can have the time, things are calm, you can sort it out, you get to know them, you hang out, you play stations, club chairs, crackers. Our place has a full-time kitchen. They do 3 meals a day for free up at St. Anne's.
I
People
love
hang out
that.
there and they talk to them. How you doing, Charlie? And they have relationships. And with relationships, you can help them. Hey, how'd it go with the social service thing? Did you see Joanne's over there? She wants to do your results for your hepatitis C thing or whatever. The point is, you have a place where they can go and have multiple services and treat them individually. There's no such thing as a single cure for this issue. That's a crazy notion. People have that idea. I don't know where they get it from. Like, strep throat, take penicillin. Yeah, but this isn't strep
Right.
throat.
Right.
This is a multi-complicated thing. It has to do with dozens of weird things in someone's life, who they are, uniquely designed for that individual person. That's the only way to deal with this. But giving them morphine as a start, it brings them into the house.
Right.
Like Barnum and Bailey said, you need asses in seats. They're going to come in for the free drugs and the free sandwiches and then swag, sneakers, hoodies, cool stuff. Anything you have to give them is cheaper than getting shot. They get shot, you're out $500,000. They get arrested at $60,000 a year. It's just cheaper to give them a hoodie and a sandwich and some opium. It's just cheaper.
Do you try to help with housing as well at that facility? Like get people into subsidized housing?
Yes, they have every program. They've been there for 40 years. They're connected to every program you can imagine. But there's problems. Oh, we only have 2 beds.
Right.
Oh, they're open on Tuesday because nothing's funded. If I want to build a battleship, I could have it probably done in 6 weeks for $18 billion. It'd be done by spring, an aircraft carrier. That apparently is not a problem. We can do that by snapping our fingers. One phone call from the Pentagon, you get a battleship.
Yep.
But this isn't funded like that. There isn't like that kind of infrastructure to do this. But we have hospitals. So every hospital in my delusional fantasy would be a drug control center. Like one of the wings or one of the floors is dedicated to giving people opiates 3 times a day with an ID card, anonymous ID card with their picture. They take it on site so they can't deal it, And you sort the details out as you're in flight. But the point is, you give them resources like protein shakes. They like sugar for some reason. Give them Snickers and
Right.
television and stuff. Maybe look at the
Energy drinks.
And no, I don't like energy drinks. Those are bad. But the
I know,
point
but
is,
they like it.
you like it, right? You give whatever you want. You can give them to make them come in and make it friendly and nice and not blaming and not shaming. Just hey, from their point of view, you're here to help them. On the right and the political corporations, you can't say you're there to help them. They won't give you money to help these people. I don't believe. They will give you money to save money. If New York State found out they could save $30 billion a week, okay, in New York State, probably $5 billion. A billion, let's call it $1 billion a month, whatever. It's a lot of money. Yeah. They could save that kind of money by doing safe supply, and that they could sell.
That would have helped me. That would have
everybody.
made me stop stealing. I wouldn't have had to go do the things that I would normally do and get in the trouble that I caused myself financially, legally, losing my children. All of those things could have probably been prevented if there was something like this in place.
Thank you. That's the point of it. But you can't sell that. That's what will happen. But that has to be called a side effect. The way you can sell this to the general population of straight people is to tell them we're spending too much money on these people with police, prison, and ERs. It's costing us too much. Let's just give them morphine. They'll shut the fuck up. They won't cost us anything, and let the doctors and nurses deal with them. That's how you have to sell it. They won't be in the street. They won't be selling drugs to your kids. They won't be hanging around schools trying to get new customers. Prostitution, spreading AIDS and hepatitis C around, all these things would go away if you give them the opiates. They won't be out hustling.
What if somebody was a chronic pain patient and they could not find a doctor? I get so many messages from people struggling. They cannot get their medication. Would they also be allowed to come there?
Yes, it's a Venn diagram. It's an overlap. The circles. A lot of chronic pains become dependent on opiates. They're opiate dependent. If they didn't have whatever gave them chronic pain, they may never become, but now they are.
Right.
And the amount you need to get relief increases, but this toxicity is locked. The amount that will kill you is called the ceiling. That doesn't change. But the amount you need keeps increasing over time to get relief until you get here and you die. So it's a very tricky, the tolerance. But the death level doesn't change. That doesn't increase with time. So it's a very tricky situation to not kill them, but to keep them kind of, comfortable. And that again, how do you keep them comfortable? Well, they could swim, they could do exercise, they could do physical therapy, they can take some antidepressant maybe to make them less anxious. They could get better diet, better nutrition. You could maybe alternate their drugs so they get more in one day, less on other days. You might give them a patch, just things you can do. What you can't do is have them see a doctor for 8 minutes to give them pills. It can't be a yes or no thing. They need to be in a managed care plan for chronic pain. And we have pain centers here that do this. Like Roosevelt Hospital, Mount Sinai has a pain center, and there's like 200 people there, and they do exactly what I'm talking about. But that's what you need. But a lot of small towns don't have this. And they can't get their opiates because they're viewed as an addict, and they won't give them their pills. So they have to store hoard pills, take it from other people, buy it in the street, and then they get in trouble. And then we have registries. They show up and they went to 2 different doctors. It shows up on the registry. And I just took a course. The DEA had an 8-hour course I took to get my DEA registered. It's a new thing. And they had a whole module just about this patient. You kind of find out they're seeing another doctor and getting pills from 2 doctors and how to deal with that. You don't fire the patient, was the bottom line. You talk to them. Listen, I care about you, and this is a little bit dangerous. So we'll keep going forward. I'll keep giving you medicine, but we have to have a contract and an agreement that you won't get drugs from somewhere else because I can't manage you that way because it's too dangerous. If you need more medicine, you have to talk to me, and we'll figure something out. But you need a system that's incentivized to work correctly. Doctors aren't going to give opiates to people because you're going to lose your job. You're going to give opiates to somebody. They're going to go drive their car into a bus full of nuns or something, and now you're fucked because you're the doctor who gave opiate to this guy who was a substance abuser, and you're the doctor who caused the death of all these people. And the family goes, "You killed my son. My son was getting opiates from you, and he was taken from someone else, and he died because of you. You killed my son. So you're in trouble." And that's very scary for a doctor, so you can't.
I've had multiple doctors, actually 3, incarcerated because of overwriting prescriptions.
Well, that's dealing drugs. That's different. That's called diversion. If you're running a pill mill and yourself as an addict and you're selling 500 pills a day, you're dealing drugs and you're not a doctor anymore. But I'm talking about a legitimate physician who's trying to take care of a community upstate that has 200 addicts who all want opiates, and they go into different doctors and stuff, and they're very aggressive. They make you feel bad. They shame you. They guilt you. "Doc, I thought you cared about me. You don't like me anymore. I thought I could trust you. You're a great doctor. You're really smart. I really admire you. Can you give me more? I know I have 10 days left, but I lost my pills. My cat ate them. Can you give me like another 50 opiates?" And then they get angry if you don't give it to them. Yep. Because now you're trapped in this weird thing. So you have to take this course that teaches you how to deal with this kind of patient. But it's a very sticky wicket for doctors. You can't. You're liable for when you give medicines to. If I give someone too much insulin and they die from insulin overdose, that's bad.
Do you refer them to psychiatry when it gets to that point?
Yeah, but who has money for that? $400 a week.
I think a lot of the problems in Vancouver too, because they had success in the beginning, but they had a lot of people that weren't coming in because other doctors were basically bashing the program. Have you had any issues with that? Because that's why they claimed it failed. Oh.
You can't have a van handing out medicines on the street like in a neighborhood.
Right.
You have to have a center, a building where they go in and they register, have a seat. Oh, okay, let's take your blood pressure. How you doing today? Did you have any food? Where you sleeping? Are you sleeping outside?
Right.
Yeah, we'll give you, here's your opiate. Okay, we'll talk when you get high, we'll talk later. And over weeks and weeks, you develop a relationship with them and you treat them. It isn't just pulling a van up to a neighbor and handing out pills.
What if someone's pregnant? Because I've been in that situation before. So it would still be no problem.
Well, I would have to talk to an OB doctor, because withdrawal from opiate is probably as dangerous as taking it. So they probably get a lower dose or something so the baby can develop normally. I don't think morphine stops the baby developing, but I could be wrong. It might be bad in the first 10 weeks or 12 weeks, but maybe it's not so bad in the 7th, 8th month. I don't know. That'd be an obstetrics problem. Exactly my point, though. You have to get obstetrics involved.
Right.
That's their job. Okay, you got a pregnant woman who's addicted to opiates. What do we do? They know what to do. They've done it 1,000 times. I don't know what to do. I don't do that. I don't replace eyeballs. The eye doctor does that, They know how to do with eyeballs. I don't do that. And we all have special things that we do really well. But, and also homelessness. I don't have a supply of apartments to give out. I don't have any assisted living buildings that I own. So the only way to do this rationally is to have drug control centers. These people go and get their opiate as a way to win them in, to get them to come in. Yep. And then you offer them whatever you can. And you have to make a plan unique to every person. That's all I'm saying. The primary goal, like when a building's on fire, flames coming out of the window, you don't have meetings. You don't sit outside with card tables and talk about who's going to own the building, who has the insurance. You have to put the fire out.
Right.
The first thing that happens, you call the fire department. Trucks show up and they put the fire out with hoses and axes and all kinds of crazy shit. They put the fire out and they leave. Then the next 2 years is spent, or 3 years, sorting out what to do with this burnt out building. Who owns it? Who's going to pay for it? Where are these people going to live? You don't do that while the building's on fire. Same with this. Right. It's crazy. You got to put the fire out. So you give people opiate 3 times a day. That's putting the fire out. It takes the drama out of it. Now you have months and years to sort these people out in a safe environment. They're not going to get poisoned. They're not going to use the emergency room. They're not going to use fire trucks all day long. 85% of fire calls are for medical. 85%. Prisons are 85% drug related. What's 3 million times 60,000? How much money is that? I don't know. I can't even do the math.
Me either.
It's crazy.
180.
You don't think it's cheaper to give the guy 50 cents of more? You give him 50 cents of morphine, he won't go to prison. They all have all kinds of complicated, multiple problems. But you can't give them a pill and say, have a nice day. That's not going to help them. You have to bring them in. The opiates is the, when they do, like in supermarkets, they have a sale on milk and they put it in the back to get you in the store. Yep. Like Macy's, 50% off on black shoes or whatever.
Yeah.
That's to get you in the store. And when you walk around to find these things, you're going to buy other stuff. That's how this works.
What if someone's like 14 years old, 15 years old?
Then they have to have
people do struggle.
When 50-year-olds get leukemia, when a 12-year-old gets leukemia, we treat them. How? Parental consent. They can't consent themselves for any this is like any other medical treatment. There's doctors there, there's nurses there. We're going to give you opiate as morphine as part of our care plan. But it's a doctor-patient thing. It's protected by all those things, all those laws that protect minors in any other situation when they break their leg in the schoolyard. We don't not treat them because they're 8. They go to the ER and we treat them. We try to find their parents and figure out what the fuck to do. But they have to get consent, obviously.
Right.
Okay.
Good answer. Thank you.
What's your theory on where all these substances are being made? Because I'm curious how we can stop everything as it continues to grow and nitazene start becoming an issue. How do we stop that supply?
It cannot be stopped. If you could make $100,000 a week selling avocados, there'd be a huge avocado problem. It's about the money. Drug dealers are not about drugs. They're about money. They make hundreds and hundreds of billions of dollars doing this. They're not doing it because they want to sell drugs. They would sell anything to make this kind of money. It's all about the money. And unless you remove that incentive, it will never stop. You can arrest in Baltimore, you could face recognition, the top 10 drug dealers in the city, arrest them. In 6 hours, there'll be guys taking their place.
Yep.
The money's too much.
Right.
You want to work at McDonald's for $6 an hour 40 hours a week and that can't live anywhere? Or do you want you make $3,000, $4,000 a day, $5,000 a day, being the drug guy in your neighborhood? The money's huge. It's the incentive.
Yeah, we need to legalize substances and end prohibition. I agree with you, Sarah.
Yeah, but I think it has to be, particular opiates and amphetamines and cocaine, things have to be medicalized. You can't make it like recreational, like pot. Pot's okay. Pot's no worse than alcohol. It's probably better than alcohol. So I don't mind the recreational pot stores, and that's a great idea. But you can't do that with opiates.
How would we do that? Medicalize all that stuff?
You'd have, like I told you, like in a harm reduction center or a hospital, you'd have a center, a drug control center, where you go in. There's a nurse and a doctor and people there. They talk to you. They figure it out. They give you your opiate. You're say injectable morphine,
right?
5, 10, 20 milligrams, whatever. And then they watch you. And then they figure out what your dose is over the next couple of weeks. And then they maintain you. And then now that you're maintained and you're coming in, hey, Joe, how you doing? Hey, Steve, how are you? You get to know them.
It's going.
And you gradually make a record in their chart. He's homeless. He lives with his aunt. His aunt's very sick. She's in a wheelchair. He's on the second floor. She can't leave. He has to buy her groceries. He used to work in a hardware store, and he hasn't worked in 5 years. He got out of prison 7 years ago. He has a parole officer, et cetera, et cetera, et cetera.
Right.
You make a chart for this guy and you figure out how do we help this guy if we can. But just giving him drugs and saying have a nice day will not help this guy.
Sure.
It's a window into their life. Like obese people who have diabetes. You can't just give them insulin and say have a nice day. You got to get them to lose weight.
Would these people be able to get literally any service, or are there some things that can't be provided?
If you were a billionaire, you're telling me you couldn't get some service somewhere for whatever you want? You could have a yacht flown into your backyard tomorrow. If you're a billionaire.
I'll take it.
Right.
Yeah, so it's just money. It's all it is money. How much money you want to. But it'd be really smart to make a strip mall pattern inside a hospital, right, with the 12 services, and then replicate that in all the hospitals. So it's in a hospital because you're gonna need security because the cartel guys are gonna come there and kill everyone and put their heads on sticks because you're taking their money away. So you need the Marines out front for the first couple of years.
Why is it so hard getting everyone in the government on board, though?
Well, it's like the Roman Empire. When you build a huge, gigantic institution with, I think government has 60 million employees or something. I don't know, it's huge. It's the biggest employer in America, the government. It's hard to change these guys. It's an institution. Let's say you wanted to change the color of post office boxes to green or to pink. That would take you 10 years.
Yep.
To get Congress to vote on that. And they probably never would. They don't like the changes. They're not good with change. And the psyche of this for decades has been drug dealers are bad and addicts are guilty. They're not victims and they're not patients. They're criminals and commies and the boogeymen. They're prostitutes.
How close are we to this?
Thieves. And I think to make this happen, and I'm not a political animal. I'm the opposite. But I believe that the way to do it is through money. You'd have to put a package together, get 20 people together like a team, and make a presentation using economists from Harvard and economists from Yale to put together charts and pie charts and a 50-page presentation to prove how much this cost, keeping drugs illegal.
Yep.
You add up the cost, prison costs, police, fire trucks, hospital. And that comes out to 30 billion a week, say. I'm sure it's around there.
Wow.
Then you go, okay, this program we're offering will cost you 1 billion a week, or 10 billion a week, doesn't matter. It's 20 billion less.
Yep.
And you go, and you don't have people begging for money in the street. These people stop doing crime. They stop nodding out in the streets. They stop the prostitution to make money. They're not giving money to drug people who use it for bad purposes. They're not getting poisoned all over the place. They're not selling drugs to your kids in the schoolyard anymore because we're giving them morphine. They're not going to go out and try and sell for become a salesperson. It works like Amway, So you put all that together with really smart, not me, but people have more, gravitas than me, and you make a presentation, and it's called a white paper, and you do it like anything else. Let's say you want to build all new lighthouses on the East Coast. How do you do that? I don't know. You study the lighthouses, how many there are, how important they are, what they cost to build, what state of repair they're in, and you put a plan together, a business plan basically, and you try to get money to fix the lighthouses. It's a big thing.
since so much of it is obviously about money too, what do you think there will be a problem from drug dealers and like cartels and stuff because they make so much of their money selling to us? So what happens when their money starts running dry?
Oh, they're going to kill everyone.
You need security.
I
That's
would
why
guess.
you need security. Yeah.
They're gonna
You
lose.
got to have the Marines out front for the first couple of years. They also probably own a lot of Congress too because they have a lot of money.
Yep.
They have a lot of corporations they own in America. It's not like the movies. The cartels in suits, and they have lawyers.
Do you have anybody
Not like,
that's willing to do
it's not like-
this with you?
Well, I don't think you can't really get doctors because of what I said. For example, I talked to the harm reduction where I do the medical lab for them. They can't come out and say this either because they get funding from dozens of sources, like state sources, city sources, private individuals. And if they started giving up morphine at their place, they'd probably get defunded.
Right. It's a lot of red tape, and I
It's
feel
the
like
right thing to do, but it's a hard thing to do.
yeah.
I think you'd have to create a white paper, like an academic, political. You have to find a political animal who gets things through Congress, basically. Like a group, some kind of, are they lobbyists? I don't know what they're called. Some kind of entity whose business is getting government to like build a new road. You want to build like a high-speed train from Boston to New York. Those guys. Who puts that plan together to present it to Congress?
Right.
To get $80 billion to do that. That company is probably called Adamson and Nicholson, whatever, some law firm or some political firm. You know what I mean? They would have to take this on, like a not-for-profit one, to put together a presentation and a study to get permission to do a pilot, not even to do the project.
Right.
Just make one such strip mall in one such place, get 200 substance SUD people, track them for 2 years, and demonstrate that these people only cost us X dollars. And the other 200 that weren't in the program cost us 10 times X, 50 times X.
It's so sad that it comes down to money.
Well, welcome.
I mean, that's the way the world is. Right. That's the way the world
No,
is.
it's not the way the world is. It's the way humans are. Penguins don't have money. Giraffes don't have money.
True.
Wolves. Only us. It's the way humans are. It's not the way the world is.
How long would it take if we started getting these out there, like everywhere? You could find this in every city. How long do you think it would take to actually make that difference and get OD rates down as much as possible?
Well, every time you got one person, a single person, and you gave them morphine 3 times a day and care for months and months, that person would not be part of the problem anymore. The next day you'd have 2 people. I don't know. It's like how did Amazon start? I don't know. They didn't start as Amazon. I think you sold books at first.
Mm-hmm.
I don't know. But you save the world one soul at a time. Once you got 1,000 people, that'd be 1,000 less people costing us money. Once you got 100,000, there's only 3 million drug addicts in America that cost money. So 3 million people.
It's not
Most of them are on pills anyway.
Right. Yeah.
It's not that many. Well, I'm looking for people who are against this.
Okay.
No one's against this. I'm looking for people who want to tell me what's wrong with this idea.
Right. I think it's
good-
excellent. I think it's an excellent idea. I think it would really help people to like maintain, like you said, not have to keep chasing that vicious cycle all day.
Yeah, but again, that's exactly true, and it's going to help these people tremendously and save their lives. But bizarrely, you can't sell that.
Where all has this worked, and what did they have to do?
Well, some countries decriminalize.
Sure.
And some places have little programs like in Holland or stuff where they give out opiates to a small percent of the people. But we're America. We do it big. We have strip malls. How many strip malls do we have? A lot.
Yeah.
So make a strip mall like this. We're good at strip malls and malls. All the malls are empty anyway. But you could make, basically, like you said, a strip mall with all these services. You have to have a court there. You have to have a judge. 5 hours a day, whatever. That costs money. Got to have court people because they have all kinds of warrants and legal shit to deal with. And then you have to have, like I said, 12, 15, 30 different services there.
Do you have like a Uber or something that can bring people there also? Because I think that's one of the big problems is accessibility sometimes.
They have transportation vouchers. They work that out. Listen, if you went to this place at St. Anne's Corner or go to their website, It's highly organized. I've been doing it for 40 years. They have all this stuff covered. What they can't do is they cannot give morphine. That's what it is. People have to shoot up in the street still. And that's the only piece that I don't like. The rest of it's flawless.
Wow.
They have everything. But they don't have, well, the services they refer to are all underfunded. So we have 4 beds. We can take 2 guys. We can see him once a week. Oh, he can have an appointment with the dentist 2 months from now. So it's very limited. You know what I mean? It's there, but it's very choked. It's very kept small. But when they shoot in the street, it makes them very sick.
Right.
Because they get infected, and their hands get fucked up, and their arms are all fucked up, and their feet start to rot. Then they can't walk anymore. Now you got a bigger problem. The guy can't walk. Then we have to amputate his foot, but he doesn't want to amputate his foot, so he has to have a dead foot. Then he's on antibiotics. He's in the hospital 8 months a year because his foot's infected and he won't remove it. So we have to give him antibiotics. I would chop his foot off and give him an artificial foot, but he's not into that. So he's in the hospital 8 months a year getting antibiotics. And eventually he gets resistant. The bacteria is resistant and eventually infects his brain and he's dead. But that takes a couple of years.
Wow.
And they have hepatitis C and they turn yellow and die in the street. But hepatitis C is 100% curable with the medicine, which costs $3,000 a month, whatever it costs. But it's 100% curable now. That's a miracle of medicine right there. That's like penicillin.
Yeah.
There's a medicine now that cures hepatitis C 100%. And they can't get it because it costs too much. But when he gets hepatitis, you don't die in a half hour. It takes you 3 years to die. That costs you $400,000. ERs constantly, turning yellow, getting IVs, They don't die. They keep recovering. So it's just silly to not spend money on the front end. So you could spend $10 on the front end or spend $10 million on the back end. I'm just saying spend $10 on the front end. That's all I'm saying. It's very economical. And I think you got to get someone who's like, a political animal at Harvard or Yale somewhere who does economics to do these, the voodoo analysis and demonstrate that it's cheaper to do this. That's how you sell it. Now, like I said, the side effect is it's a very compassionate, kind, rational thing to do. But you can't sell. I've seen a lot of news stories and seen a lot of things. You cannot sell compassion. You can't sell science anymore because science is all fake. You can't sell rationality because you're not rational. You're a leftist. You want to help homeless mothers or give food to school children or, keep kids and provide daycare for parents so they can work. That's lefty. Now you're a commie or a socialist. It's crazy. New York State, there's a federal law in America. If you're injured, the ER has to, if they're getting federal money, the ER has no choice but to provide you care at any cost. You get shot in front of the hospital and your name is Pinky Dinky, you have no name, you have a fake gang name and you're 12 years old, you get shot in the shoulder or chest, they have to care for you. It's going to cost them $500,000. Right. Then after you're done, they try and get Medicaid to pay them or with that, state, they try and get money to cover their costs because they obviously can't operate losing $10 million a day. But the state taxpayers are paying for Pinky Dinky getting shot. They think the hospital's paying. They don't realize it's not. It's the Fed. The state pays and the federals pay.
I've been in like the sub program, and one of my buddies, he was in a methadone program, and I do agree the methadone programs in some ways they're good because they do provide some of the stuff. But it is very in and out, and some of the sub doctors are the same way. But where would the competition be whenever it comes to sub doctors and you? Because I could see a lot of pushback from them trying to stop all this and say subs are better. Is there going to be like a whole bunch of...
What's a sub doctor?
Suboxone.
Oh, Suboxone. Oh.
Right.
Yeah, I don't give a shit. Use Suboxone. I don't care, but I would use morphine first for the first 3, 5, 7 months. And then when they want to recover, if they ever want to get better, like I said, I don't want to be here anymore. I don't want to live like this. I don't want to be high every day.
Right.
Oh, yeah, Suboxone. There's a door right there. Go through that door, and that's called recovery. That's a different space. This is not recovery space. This is keeping you high space. So you don't fucking get in trouble.
Yeah. Years ago, when I wasn't ready for recovery, I abused methadone. I was getting it from the clinic and my primary care doctor and double dipping.
Yeah. I know. Everyone,
That's because I wasn't ready.
The beauty of the I don't care space, which is tough. I know it's a tough sell, but it's really smart, It's called I don't care. It's called we don't care, this space here. We do not care.
I love that, though.
Here's morphine 3 times a day. We don't give a shit. You can stay here for 50 years. We don't care. All we're asking is you don't get shot, stabbed, or arrested. You don't cause any fucking problems. This be harm eradication. They won't get infected. They won't get overdosed or poisoned. They won't get brain disease. They won't lose their legs. They won't lose their arms. They won't get heart infections. They won't get liver and blood infections. They won't get septic. None of that's going to happen. They'll be perfectly healthy, like you and I, for as long as they're there, because they will never, ever get sick. The morphine doesn't harm anyone. It ruins your life, but doesn't harm you. What harms people historically is what's in the morphine, because it's impure and not sterile. If you were in a hospital, Kyle, and I had to give you antibiotics, right, because you had meningitis, or not, forget that. You had like an infected arm, like your arm's all infected from a cut or whatever, right? Sure. And I hang up a bag on your IV, and then I put in this powder from like a Ziploc baggie. And you go, what is that? I go, it's penicillin. Where'd you get it? I bought it in the park from a guy named Richie. But how do you know it's penicillin? Well, Richie's a good guy. I know Richie. He's a good guy.
Right.
So I'm putting penicillin. I'm giving you IV penicillin that I bought in the fucking park.
I'd be going
why is that not okay for you? Why do you have a problem with that? But you're forcing every addict to do this. Huh?
I don't know because I've been there. Yeah.
No, but you don't know what's in that bag. I don't know either. Nobody knows. Yeah. Because I bought it from Richie in the park. All the controls that we use in a hospital to keep our drugs safe and clean and sterile are very strictly controlled. They're locked up, they're measured, they have numbers, they have code numbers, they're sealed. It's very complicated, but no one can, it's very difficult to fuck with it. You could, but probably not. You can, when you get penicillin at a pharmacy, it's very likely going to be penicillin.
Right.
They have no incentive to fuck up their drugs. They make money because you can trust them that it is penicillin. With me?
Absolutely.
So no one in a hospital will accept street drugs for their illness, like street insulin or street antibiotics or street chemotherapy. Imagine if I put chemotherapy in the park or in an alley somewhere and gave it to your daughter. You know, what the fuck is that? Right. And yet every addict is forced to do this, to buy drugs in the street.
Right.
And not only might they be poisonous, they are almost always poisonous, either with bacteria or crap that shouldn't be in there or fentanyl.
This also gets rid of a lot of the pharmacy stigma issues too, because so many people go to the pharmacy and have so many struggles. I mean, if this was all just the same thing, same strip mall that everybody's going to, there's no more issues with that, because that's one of the reasons a lot of people don't get into certain programs.
That's very lovely and very sweet, but I promise you, free morphine is enough.
Right.
Fuck stigma. If you gave them free morphine, they're going in.
Right.
A line around the block.
Right. I agree with that. Free
sterile morphine? Are you kidding me? You get every single addict for miles wanting to go to this. And you have to make a lot of places so they don't get overcrowded, because you can't have 800 people waiting in the street because the cops are going to get involved. Right. And neighborhoods won't like that. So you have to have like hundreds of these places to keep it spread out. But free morphine, for God's sake. If they don't want that, then good luck to them. I don't give a shit. And, street drugs will still be illegal. Right. I'm not changing any laws. You want to arrest drug dealers, God bless, have at it. But listen, you can get your drugs here for free, and they're sterile, and we're nice to you, and we don't make you feel shitty, and you get a free sandwich, and you get brand new sneakers. We have a clothing store with all kinds of clothes. Get anything you want. Winter coats, cool hats. We have showers. There's showers at my place. They have an individual, and not co-ed obviously, but they have showers with a person, so they can get showered and clean. They have a laundry machine, a laundry room to wash their clothes, and they give them like sweatpants and sweat jackets to wear while their clothes are getting washed.
Would someone who's not coming in for the morphine and everything, they would be able to use any of these services, correct?
Well, then you have a homeless shelter, I guess. I think they'd have to make a separate place for that. Yeah, the strip mall should be for homeless people too, sure. But the heroin isn't for anybody who walks in and just wants to try heroin. That's for people who are dependent on morphine already.
Right.
The homeless situation is a whole other ball of fish. 85% of foreclosures in the United States is a different show. 85% of foreclosures on homes in America is because of medical expense. And that's because we have a national military, we have a national highway system, we have a national post office, we have a national tax system. We have all these national systems. We do not have a national healthcare system. We're the last country on the planet, to not have national healthcare. In Sweden, the average fee per month for everyone in Sweden, without exception, is $12.
Wow.
So $12 a month $12 a month taken out of your paycheck covers healthcare for every single person in Sweden from cradle to grave, including Alzheimer's care, old people who get, need institutionalization. That's all included. So no one goes bankrupt in Sweden ever because of an unforeseen, well, actually it's a foreseen medical expense. Here, it's all designed to make money.
And I think the biggest problem with a lot of the healthcare systems, they have trouble keeping up. And would that kind of be the same situation with this? I mean, no matter what.
No. Sweden does not have trouble keeping up. Sweden's healthcare is awesome. It's very nice and very awesome. The point is, now you're getting into management. If FedEx lost 4 out of 5 packages, FedEx would suck. Nobody would use them. People use FedEx because I don't think they ever lose a package. And if they do, they kill you and make the story go away. But I don't think they lose packages. It's highly organized. They scan everything. It's tracked every minute, and it gets to you and you sign for it. There's a picture of the box on your front porch, you know what I mean?
Right.
It's management. Right. So same with national healthcare would have to have funds to be managed. If you starve it of money, you'd have to wait 3 months to get your dental check. I told you we can build a battleship in 10 weeks with one phone call.
Right.
So we can do that. We can do this. If we can build fighter jets in like 6 months by sending a text to somebody, I mean, we can definitely build national health care. All you have to do is pay nurses instead of 30 grand a year, pay them 85 grand a year or 120 grand a year. And everyone is going to want to be a nurse then. And they'll be happy. And then have 30 patients, they only have 10 patients. So they're happy. And the patients get good care. Doctors just give them 250 grand and shut the fuck up. You don't get more. You don't like that? Don't be a doctor. If you can't live in 250 grand, fuck off. Or 300 grand, something like that, But a lot of money.
Right.
And if you don't want that, go be a plumber. We don't give a shit.
Right.
But then they get paid and they work 8 hours a day and they're doctors. All the doctors. I mean, and you can't tell me you couldn't do it. How does Amazon work? I can order toothpaste and a can of talcum powder and also a radio on my phone. And tomorrow some guy's going to hand it to me.
Right.
At my office. So we do have the technology, humans, to do this. It's not like it can't be done.
Right.
It's just we don't do it.
Well, awesome. Thank you for coming on, Doc. We'll definitely have you on again.
How do you make it hard again? Oh, yeah, like this.
Yeah, there you go. There you go.
There you go, Doc.
Okay.